Hi, I'm John, and here at the Center for New Medicine, we offer a treatment specifically for, but not exclusive to, our cancer patients. What we do is with our current studies, current methodology that they use would be to treat the area of focus. And one area that we treat with, one product, I should say, that we treat with is the what we call the SEP, the Sono Electro Pulse. What this system does is it produces very intense pressure pulse waves, and we direct it at the tumor, the area in question. And what it does is pretty much instantly reverses the polarity of the cancer cells. Okay? So 25,000 volts goes through this heavy cable. There's a spark plug like, if you will, thing in here. There's a fluid membrane, so it's an electrohydraulic pulse, which is the best kind, meaning that it's real quick up and down. Okay? So the areas that we focus on are obviously what the patient presents to us as they get here, be it liver, kidney, spleen, prostate, breast, muscular, bone, whatever it might be. We would treat that area, and we also look for other areas. That's where we differ from many other practices. The cancer itself is, and we are electronic organisms. The cancer itself tries to hide from our body by flipping its polarity. It would be negative on the outside, positive on the inside. Our normal structure is set up to be positively charged on the outside, negative on the inside. And when you have those two different, our immune system can't find it. There's also a fibrogen sheath that covers the cancer. It puts in arteries and veins. It's off to the races. It starts to grow, and it's hard to get to remedy it. So when it's hit by the pressure pulses, it tries to hide from the system, and it flips its polarity. It locks in place. It doesn't know how to flip again. Also, the fibrogen sheath that is in the covering the structure gets perforated, electroporation. So now not only is it visible to our immune system, it can be attacked and remedied. A way we go about finding the areas of concern, because we found that in certain patients, a lot of them in fact, it's not only in their original presentation. So with the polarity, there is a physics theorem that's called Lorentz force. So when it's positive on top, negative on bottom, it emits a current that goes in a clockwise manner. When it's reversed, negative and positive, which would be the way cancer structure is, it would be going counterclockwise. So how do we find that throughout the body? We use a simple pendulum. This is a piece of rose quartz, nothing fancy, just a piece of rose quartz on a string, making a little pendulum. The quartz emits 350 hertz constantly in all directions. So when one force meets another, something's going to give. For an example, here's a battery, positive on the top, negative on the bottom. And remember, when it's designed that way, it will go clockwise. So it's going to find it, then it's going to, hope you can see it, and then it's going to start pushing it in a clockwise manner. Okay, that's pretty clear. Take it away and it just kind of stops or just floats. Turn it over. This would be very representative of cancer. So it's going to find it, and then it's going to push it in the opposite direction. As you can see, it's going counterclockwise. Okay, nothing mystical about it. I could even make it go forwards. Put the battery under it. I have it negative up. It's going to stop it and then push it the direction that physics wants it to go. So what we do is we go through the whole body from head to toe, and we'll make a small mark with a surgeon's Sharpie. Make a small mark on them, and we'd also write it on a sheet, just a little outline of the patient. And then subsequent visits, and each visit, we would treat the patient at each mark that we find to resolve. So We check it, it's going backwards, we hit it for anywhere from 5 seconds to 2 minutes in the area until we get a positive spin, clockwise spin on the pendulum. And then we go to the next one. Usually takes about 4 visits to complete the whole body, front and back. Sometimes we get it done in 3, occasionally even 2, but we like to look at 4 visits to really get good coverage of the patient. It's been without fail every time that we've done it, it stays that way. We've been doing it for a few years now, and everyone that I've checked in that time, those areas of concern have never come back. The other areas of focus that we can do is musculoskeletal concerns, plantar fasciitis on your foot, bone spurs. It kills, because of the intense pressure waves and pulsed electromagnetic frequencies that are emitted, it also kills bacteria, virus, parasites, people with candida issues. You go through the gut and it really helps their digestion. So it's overall a really good tool, not just for cancer. Okay, so thank you for listening. If you have any further questions, feel free to call the office, and have a great day.